This Focus on Health segment is brought to you by Aurora Healthcare.
Hi everyone, welcome back to Oshkosh Today. I'm Connie Carmical. As the cost of healthcare rises, Aurora Healthcare is looking for solutions. One solution is keeping people healthy and keeping people from going to the doctor for preventative illnesses. Imagine if someone with asthma or diabetes knew how to manage his or her disease better, or if everyone quit smoking or filled out an advance directive. These are simple things they do here at Aurora under a program called Care Management. It's a way to keep you healthy. On today's Focus on Health, we meet up with Dr. Denise Phren, Director of Care Management and Patient Education. Dr. Phren, thanks so much for joining us.
Thank you.
Could you tell us a little bit about what is care management?
Well, basically, care management is a very simple idea. It's to try and use the best practice to give the best access and the best care for every patient, every time.
Okay, and then how does Aurora work toward that goal?
That's actually quite a diverse question because care management has been a big factor in Aurora's mission from the beginning. Because we're very lucky to have a continuum of care within Aurora, from the clinic to the hospital to VNA and home, we're able to serve all patients in different facets. So from a hospital standpoint, to try and find better ways to do things, some of the things we've been working on include congestive heart failure, for one. We've been working on trying to keep all education the same, whether you are in St. Luke's or here in Oshkosh, and we've been successful in getting that done. Another thing with congestive heart failure, we've been able to work with telephone monitoring, so when someone goes home from the hospital, we give them a call to make sure that they're doing okay and they're following all the necessary steps so they can stay at home. Other things include we've worked on trying to get a consistent process for patients to get their pneumonia vaccine in the hospital so the nurses can screen and give the pneumonia vaccine without the delay of having a physician to review it. Other things like our total joint camp, because Aurora is a relatively new hospital, we had to start from scratch, and we were able to go and try and pick the best things that other hospitals have done. And what we do is bring people in to begin with so they get their education so they know what they're going to expect.
Sure.
And they can understand the anticoagulation and the rehab that's expected of them.
Okay.
So that's on a hospital end, but from a clinic end, we're also very involved. Some of the things we've been working on are diabetes, and we've done very well over the years for regards to diabetes, from setting up a diabetic education program to continuing with support groups. And one of the things we're working on right now is hypertension. And the normal way things are done, you come into your physician, you get your blood pressure checked, they say whether or not it is adequate, and then you come back. But we're wondering, isn't there a better way to do some of this? So we're working on a pilot to try and, if the blood pressure is elevated, to have them come in and see a nurse on a several-time visit, get the education more in depth, and then hopefully come back and see their physician. And one of the other things that's a challenge for everyone is colon cancer screening. And the gold standard right now is colonoscopy, which, you know, it's something some people just don't like to even think about. So we highly recommend that, but there's a new test out there that if someone just is not capable of having a colonoscopy every 10 years, we're able to do a one-time stool sample. That before we always used to send home those 3-pack cards, and you had to follow a special diet, people didn't do them, and so we're hoping that with this we're able to find a better way to get more people screened.
Okay.
So that's just some of the many different things we're working on, from tobacco cessation to advanced directives to asthma screening. there's just so much out there for care management to improve patients' health.
It sounds like a wonderful program. Now, can you tell us, what can every adult do to improve their health care?
The one thing every adult can do, and I'm talking 18 and up, is fill out your advance directives. Unfortunately, people think, oh, nothing bad will ever happen to me, and we all know sometimes bad things do happen, and we want to be able to give the best possible care that you would want as a patient. We don't want to do things that, if you can't tell us what you want and you've never made it known, we're going to do the most we can. So unfortunately right now on file, even 60-year-olds, there's only about a 9% rate. 70-year-olds, 20.
That's surprising.
80-year-olds, 25. Get your advance directive, get it on file so we can all be a partner in care together and give the best care.
And I suppose younger folks probably feel that, oh, they're young, nothing's going to happen to them.
Exactly, and obviously the percentages go down the younger you get. So we've been trying to target everyone age 18 and over. If you have an opinion, let it be known.
That's great. That's great advice. Now, what types of preventative care should adults receive?
There is somewhat of a bit of controversy over this. For most women, age 18 should have a blood pressure screen on every couple year and a pap smear every 1 to 3 years. Then you hit around age 40, you should start having mammograms every year to 2, 45 a cholesterol, 50 colorectal screening, and 65 screening for osteoporosis, a DEXA scan, pneumonia shot, flu shot. Men, 18, same thing with blood pressure. Then you hit 35 for cholesterol because your coronary risk is higher for men. Then 50 colon cancer screening and considering prostate screening. And then 65, same thing with pneumonia and flu vaccine. And then if you've ever smoked, if you've had 100 cigarettes in your lifetime and you're a male, you should consider screening for aortic abdominal aneurysms with an ultrasound.
All right, well, that's great advice, that's for sure. Now, what expectations do doctors have of their patients, and what should we as patients expect of our doctors?
The biggest thing is we would all like to partner in care to improve your health. Neither side can do it alone, and unless there's good open communication, that's the best way to find the best way to take care of you.
That's wonderful. So, and do you have any other advice that you would recommend to the patients then? For sure, you know, get your physicals every year, I would think.
The biggest thing, if you smoke, stop. Maintain a good, healthy weight, healthy diet, plenty of exercise, and get your periodic screenings done.
Well, that's wonderful advice. Thank you so much for joining us today.
Thank you.
There are many topics Aurora is pioneering in care management, from asthma to osteoporosis. You can find more information on Aurora's care management at www.aurorahealthcare.org and click on About Us, or you can call Aurora Healthcare at 303-8700 and ask for the Care Management Director. Thanks so much for joining us on this Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.